My name is Monica Ferguson. I am an internist and regional medical director for quality and health equity at Northern California, Providence. So I moved here from Philadelphia, and at that time in my career, I was looking for a change. I had been out to Northern California for vacation in the past and thought, instead of looking for another job in Philadelphia, maybe it would be a good time to look for a job in Northern California. I knew as a primary care physician I could get a job anywhere, but it really comes down to day-to-day. Who are the people going to be that you work with? What is their approach to caring for patients? And I have found that this work environment, Providence is really very supportive of physicians and our APPs, and I don't think that's something that you can find every place. The reason I enjoy practicing as a primary care provider is because of the doctor-patient relationship. I really enjoy getting to know my patients. They get to know me to a certain extent, especially in Santa Rosa, which is a kind of a small town to me, especially coming from Philadelphia. I actually like seeing my patients out and about living their lives. I think they appreciate the same thing.
I'm Dr. Avinash Ramchandani, and I am a pain management specialist and physical medicine rehab specialist. So I've been working with Providence for 8 years now here in Santa Rosa, and I love the people I work with. The people are so much fun to work with, and also they are so good at what they do. I love pain management because I'm able to help people pretty quickly. As a physical medicine rehab doctor, I can help people by diagnosing what's going on. And with the pain management piece, I can actually do both together. And it's just fun to be able to do that and use my hands and use my skills to help people out where they've been struggling for years. We have a wonderful, wonderful culture in the sense that we work for people. We work to treat people. We don't work to treat the dollar bill. And that's the best part about it. And everybody's in there together trying to treat the patients and trying to do the best for them. And I love that about it.
My name is Kevin Nelson. I'm a physician assistant. I've been working with Providence in Northern California for about 2.5 years now. In terms of my healthcare journey, I would say it probably started with my mom. She was a nurse and then kind of, had some struggles with cancer herself, kind of got me interested in healthcare and medicine in general. I'd say my favorite thing about working for Providence is having a lot of support, a lot of mental health providers and nurses and doctors and medical assistants, everyone just working as a team. The culture at Providence Medical Group is a really great experience. I've had a lot of good interaction with my coworkers and the support staff, and we go out about once per quarter. We get all the PAs and NPs in our group together to go out to dinner and just talk and share tips and just talk about other things outside of work for once, and it's a really great experience. And so I've really enjoyed spending time in the area, beautiful sights, beautiful country, going to parks, going to wineries. I mean, there's just a lot of great places to hang out and spend time.
My name is Susanna Gonzalez. I'm an OBGYN physician, and I've been practicing here in Napa for over 20 years. The culture of Providence Medical Group is one of giving. We see all patients alike. It doesn't matter what their economic background or their social background is. If you're a patient of Providence Medical Group, you are going to be treated just like everyone else. One example is we offer cutting-edge robotic surgery for gynecology. This is a service that we can offer any patient that walks in our door. And it's quite a luxury. I can come to work in the morning and concentrate on what do I need to do for my patients to get them the best care. My job is to come in every morning and to be the best doctor that I can be.
I'm James Lau. I'm a urologist. I have been practicing here in Napa with Providence for about almost 5 years. I've always wanted to be a doctor as a child. At that time, I don't know why. I like talking to people, I like interacting with people. And as a doctor, I feel so good that I can help other people. I really enjoy practicing here with the Providence Medical Group. We are a very closely knit group, very cohesive. We talk to each other a lot, we know each other well, but more importantly, we can pick up the phone and talk to other providers about our patient. So I feel that the care is much better coordinated. We are able to practice medicine the way we see fit. We are not restricted by other people telling us what to do. And then at the same time, we do not have to deal with other logistic or other business issues. So I feel that we are really fortunate to be able to just practice medicine.
I have found the community to be very welcoming here. It continues to surprise me. I don't know why. For example, I went on a run yesterday morning, and as I'm running by, people walking with their dogs and stuff, everyone's smiling and waves and says hi. And even when I interviewed for this job, I could tell that the providers made time to do things outside of work hours, things that they enjoy. I don't know if wine culture is the right word, but I belong to several wine clubs, and it's great to just go out with friends and do some wine tasting. It's just a great place to live.
The best thing about Northern California is the collegiality between people here. People are super nice. But more importantly, there are things to do every day. So every week we have this running group. Right here from the hospital, we go for about 3 miles. So there was a colleague that I'd never met. She's actually the bioethicist here at the hospital, and met her now every week for the last, 8 weeks or so. Wonderful person, and so cool to meet people outside of my normal group. That's what I like about it here.
One of the most impressive things that I noticed when I first came here is that it's almost a little utopia. We see each other as one big community that's constantly looking out for each other. It's a place where I think you can really relate to your coworkers as your work family. I know that as a leader within this organization, my job is not only to make sure that I make it through the day and have a good day, but also extend it to my group. I couldn't be more thankful to this community and to the love and support that it offers. And frequently, many of my patients are now very good personal friends. It's one of the most wonderful places to live. I couldn't imagine being anywhere else right now.